Hello, Assalamu alaikum, and good evening, everyone. Hi, walaikum assalam, Iman. How are you doing?
Fine, Dr. Zaib. How are you?
I'm good, alhamdulillah. Thank you so much. Okay, so we are going to start our session. So, of course, in today's session, we are going to be talking about the early pregnancy care module. So, this module itself is a very important one in terms of exam because we got to see so many important cases for this. And I am going to tell you, like I always do, that I will try to give you an overview at how this module works, and then we are going to do one of the the station practice as well. So this module basically will focus on early pregnancy care complication and their management. So what RCOG expects from you is that at least being a specialty trainee, you should only be very knowledgeable about each of these complications, but should be able to demonstrate how to manage these, including how to perform surgical procedures and also discussing the options of the care with the patients. So this is going to be very much important in terms of the clinically the management and as well as the counseling as well. So the topics covered in this module basically are the very much important because you are going to be dealing with early pregnancy. Yeah, so early pregnancy is quite the kind of sensitive the area where you have to deal with a lot of the normality as well as the kind of problems or complications of early pregnancy as well. So yeah, nausea and vomiting in pregnancy is going to be there, hyperemesis gravidarum can be there, miscarriages, all the different types of miscarriages are going to be there as well, ectopic pregnancies, and well, it can come as in the different stations. For example, the patient is coming is in acute condition, number one scenario. Patient is coming as the suspected case of the ectopic, and the third can be the recurrent ectopic, and the fourth can be even the ectopic in which it has been ruptured, and then you have to do any of the evaluation, or there can be any of the element of the, for example, they can bring the blood transfusion, the concern in that area as well, like Jehovah Witness if patient is, or no. So yeah, nausea, vomiting in pregnancy, trophoblastic diseases, molar pregnancy. There can be a patient who has a scan with complete mole, and then you have to break the bad news. There is a patient who has a scan with ectopic pregnancy, and then you have to break the bad news. There is a patient, who is very much worried about that, the this is her, the precious pregnancy, and then you have to break the news. So altogether, this is going to be, the module which is going to test your communication skills along with patient safety. Likewise, the communication skills is not the different than your, of course, you are going to communicate on the basis of what? On the basis of your clinical knowledge, on the basis of your the practical skills, how you behave, how you talk, how you break the news and all. And of course, patient safety is going to be the prime element over there. So as an exam candidate, what you have to do is that you have to learn how to break the bad news, how to give information in chunks. Okay, so don't try to bombard, don't try to bombard a patient with the loads of information for the patient who is already vulnerable, for the patient who is already the kind of on verge of you can say the breaking up. Because of course the who is going to be in this setting, so she will have the some of the the hinge that okay, something bad is coming up. And as an OBG, I'm sure you must have seen that some of the time when everything goes fine, everything is good. But when it comes to the breaking bad news, then yes, this is going to be a very tricky area. This is going to be a very important the perspective for every OBG there is. Okay, so the possible tasks, like I have told you, the management as the miscarriages management, management of molar pregnancy, management of hyperemesis gravidarum, management of the ectopic pregnancy. Yeah, because the management is quite vast. Yeah, cervical and cesarean scar ectopic, very rare possibilities of ectopic pregnancies, various types of miscarriages, if it is threatened miscarriages, threatened miscarriage, inevitable, complete, incomplete, septic, plus as well as recurrent, isn't it? So we have got the various types of all miscarriages, and we have got the various types of ectopic pregnancy, and yes, the hyperemesis gravidarum and molar pregnancy. So none of the exam is going to be out of the one station, because this module will solely touch your applied clinical knowledge, communication skills blended with patient safety. So sometimes there can be any case in which you have to review the histology report and do the appropriate management. For example, if it is complete, incomplete mole, for example, if it is ectopic pregnancy, etc., etc. Okay, so the breaking the bad news. This is going to be, the critical thing in this module. Okay, so you have to be, the expecting a difficult patient. You have to be expecting a crying woman. You have to be expecting a lot of emotions, of course. And now this is going to be your exam, how you deal with this woman, how you bring her to the point where she is ready to listen to you, how she is ready to take the the advice or the management. And by the end of consultation, of course, she has to take some of the decision that how she is going to be managed. Or if no, then don't bombard her with a lot of information in one session, and just give her the news, or just give her the feeling that this is such a the difficult thing which cannot even be managed appropriately or properly. So for the breaking bad news, because I have been getting a lot of messages that that how we are going to break the news. All right. So I am pretty sure that all of you know by now, by this much of preparation, that how we are going to break the news. Okay. So I'm going to tell you just a brief overview that how it is to be done, and how we have to do it. So first of all, before the breaking bad news, we do take spikes protocol. Yeah. Spikes protocol means the first S is going to be the setting. Setting means that, for example, if it is written, in front of you that you are covering a busy labor ward, and, the one of the family member, or, the whatsoever, or you are covering, the busy ER, and you have been called to, the talk to this, the relative or the patient, so of course, you can't give this, the breaking bad news in a very busy setting. Okay, so you have to tell her that, okay, is it okay that if we sit the somewhere in a quite the nice place where I can give you the information, okay, where I can talk to you in private, where I can the assure our confidentiality whatever we speak. And plus, it's a very good idea that when you are making a setting, let me tell you, this has been RCOG, the course station once. Okay, where there was the patient who has been using the cell phone, okay, mobile phone. So she was continuously on the mobile phone, and doctor is talking to her, and she was not listening properly. So of course, this is also a very good the deal, good thing to deal these days. So I personally also come across with so many patients while I'm in my clinic. So of course, I have to tell them politely that, can you please, keep this phone, the away, or can you please just listen to me, what I'm telling you. The same you have to do in the exam. For example, if you get a patient, who is busy over, the phone, and she is not listening to you, and yet you have to address so many important things, just tell her politely. Tell her that, look, I am going to discuss a lot of things, and I need your proper attention. So would that be okay that if you just keep, this phone aside for a couple of, the minutes, so, I can discuss the options with you. This is also one of your exam. Okay. So likewise, in the setting, of course, may not be in the real exam, but of course in real life scenario, when you are talking to someone, okay, it's a good idea that you also turn off your phone. Okay, you also yes, not another meeting, but ask her to not turn off, just keep this phone aside and just listen to me, simple. Okay, another meeting, what then? Are you going to meet her in another exam? Of course no. Okay, so always remember, don't always offer that, okay, shall I see you in the another meeting, so what you will do in rest of your station. Okay, so then, the second, the thing for the spike protocol is going to be the perception. Perception mean that, what is the patient's perception and understanding of his or her condition. Like we always say that, have you ever heard about it? So I have your ultrasound report with me, and in it, it shows this. So have you ever heard about it? Okay. So then you are going to, of course, they make a, the note in your mind that, okay, this patient has this perspective. It means that you have to give her news in a way that she is going to absorb, she is going to understand. Invite question. Okay, ask her. Okay, so tell her that, okay, I'm going to give you, this much information. So, let me tell you that how can I help you. Okay, or would you like me to handle the information that will obtain from these tests, or are you the sort of person who wants all the details, or the just important detail? This is also one of the way. Then you are going to give her the knowledge. Okay, and that knowledge should be factual. There should not be any the kind of you can say the ambiguity while you are talking, while you are giving her knowledge. And knowledge should be factual. Knowledge should be based on what you study from your guidelines. Okay, so knowledge should be there, and you have to give that knowledge again in small chunks. After giving the one type of management, always involve, am I clear so far? Okay, I mean, am I clear up till now? Do you want me to repeat anything? Okay, so this is how you are going to check the understanding at each step. It's not only that you are just going to bombard her with the knowledge, okay, this, and you are not going to the offer her any type of the kind of this feeling that okay, you are with her and you are trying to understand, you are trying to help her or something. Then empathy. Being empathic is the prime the thing in such type of stations. And this sometimes can be very much the possible. Okay, so you can simply the bring whatever sentence you think you are well versed with. Sometimes you can say that I understand that this is quite the hard for you to absorb. I understand this is so much for you to take in at the moment. And the recognize if she is crying. Okay, give her time. And at the same time show some of the emotions from your the body language, from your facial expressions as well, that okay, you are with her. Okay, and you feel her pain, and you are here to to give her the news. Okay, so give her don't give false hopes. Okay, and this happens in the ectopic pregnancy and miscarriages and molar pregnancies as well. Don't give her false hopes. Just give her factual knowledge, whatever you know from your guidelines and all. Then you are going to explain the last S from the spikes protocol is going to be the strategy. The strategy means the management, how you are going to manage her further, how you are going to give her the options regarding her the treatment. But don't interrupt. If she is trying to the express her emotions, don't interrupt. Don't just assume that patient knows everything. Remember, part 3 is not about assumption. Sometimes because I do teach as well, so my some of the students sometimes they do say, so I assumed that patient already know. No, there is no assumption. There is no role of assumption at all. Okay, so always try to extract the knowledge and then give the knowledge accordingly. Then there should not be any blunt disclosure that okay, bye. No, just bring her to the the point where you are going to negotiate in terms of management as well. Don't try to use a lot of medical jargons, and don't the destroy any hopes. For example, this is molar pregnancy, and sometimes you are giving her this. We know that recurrence is there, but how much recurrence is there? At least give her some hope that after this much time you can have the normal pregnancy. And we do have the stories as well. We do have the people who have conceived after molar pregnancy, and even the ectopic pregnancy or miscarriage or something. All right, and never ignore patient input. If patient is trying to tell you something, so try to absorb that. Try to the listen to that. Try to the comprehend in terms of the what she exactly wants at that situation. Okay, so these are the some of the do's and some of the don'ts which you have to do in the setting of the breaking bad news. I hope it's clear. Is it clear, everyone? So let me summarize again. It should be in the chunks. Okay, it should be in the chunks. It should be in a way that the where the patient, let the patient know you know that finding out what caused the loss will be a priority. All right, for example, we do have ultrasound with us, and patient wants news first. This is another a biggest dilemma in part 3. The circle. Do we have to give the news first, or do we have to take the history first? Okay, there is no hard and fast rule. Okay, there is no hard and fast rule. But if patient is asking you again and again, oh, doctor, can I know what exactly is in the report? Can I know that what exactly is it with this wrong with this? So at least don't put her into unnecessary stress at that time. Don't just tell her that I will come back. Let me finish my 2 3 pages, the template. Then I will come back and I will address this concern. Okay. So at that time, you don't have to unnecessary, they give the stress to the patient. Okay. Always remember that, patient is going to guide you. Patient is going to tell you that how the station has to be. All right. So try to take those cues as well. Please do try to take the time that how you are going to express your empathy and how you are going to express that you really feel for the patient. Okay, so you can simply say that like I have told you earlier, that I understand that this must be very hard for you to take in. I understand this is so much to take in at the moment. I'm so very sorry that this has happened to you. Okay, so it doesn't mean that you are admitting something that you have done something wrong, but it's a way to convey your compassion and support to the one individual who is suffering from this loss, or the who is suffering from the any untoward situation. Well, avoid statements like miscarriage is very common. Okay, so I mean, you are lucky, at least you have other children, and it's not the end of the world. Never say that. The person who have just lost her baby, her precious pregnancy, the loss can be unimaginable. You can't even tell whether if she has 8 children, 9 children, but if she has lost her one baby, so this is her loss. Okay, so we can't measure anyone's the grief, we can't measure anyone's misery out of the any situation there is. So at all times we need to be empathic. Okay, we can't the only tell her in this situation. And trust me, I have come across with these the phrases. That's why I have written down over here. Please, candidates, all of you guys who are going for this exam, okay, avoid using such statements. Okay, avoid using such hurtful the sentences that miscarriage is very common. Okay, instead you can say that I understand that you have been through this, but let me just tell you that the miscarriage is like, I mean, the one-off event. Okay, it happens in blah 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 blah, if you know. Okay, you can simply the say it can be a one-off event. Yeah, if it is the one miscarriage. Don't say that at least you have other children as well. Avoid saying that it's not the end of the world. Okay, so don't say that. So be sure that the loss is prominently noted in the patient's medical records, so staff and clinicians have it top of the mind in future interactions with the patient. Whatever you discuss, do try that everything is in the patient's notes, and the later on whoever is going to see her, so of course will see the proper history and all. Okay, so this was for the breaking bad news, how to break the bad news, and how to the some do's and some don'ts. I hope everything is clear till so far. Yeah, clear everyone. Mm-hmm. Okay, all right. So who wants to present today,
Okay,
specifically who
doctor.
have never presented before? Okay.
Shall I do?
Okay. Okay.
Hmm. Okay, who's there? Okay, Zubia, very good, Iman. Good, 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 good. If nobody will come, then I will take, the students who really wants to present.
Okay, Dr.
Shall I
Zaib.
try, ma'am?
Who is this?
I'm Shanti Priya, ma'am.
Okay, Shanti, yes.
Good evening. I'll try, ma'am.
Oh, yes, yes, sure. Why not? At least you have to try. Unless you are not trying, you are not going to be, the, what you can say, the master on something. Okay. Okay, great.
Yes,
Let
let
me
me
show
try.
you. Yeah, yeah, sure. Take you 2 minutes time.
Yes.
Mhm. Okay. Ready, Shanti Priya?
Yes,
Mhm. Okay, great. Start.
yes. Hello, I'm Dr. Shanti Priya, one of the doctors in the early pregnancy assessment unit today. May I know your name and age?
Yes, I'm Andrea Thompson and I'm 25 years.
How can I call you?
Yeah, Andrea is fine, doctor.
Okay. Andrea, I've received a letter from the GP that you're having some brownish discharge down below, and your pregnancy test is positive today. Is this correct?
Yes, doctor. Actually, I'm pregnant and for the 8 weeks. So, I went to the GP because I was having, the brownish glandular discharge. So he sent me in over here to talk to you.
Okay. Okay, Andrea, I understand your anxiety. Next few minutes, we'll be discussing about your concerns and we'll come to a mutually agreed plan. Before that, is it okay if I ask a few questions to know more about you? How does it
Yes,
sound?
doctor. Yes, doctor.
Okay. Okay, Andrea, tell me more about your about this pregnancy. Was this a planned one?
Actually, it was not the planned one because me and my partner we both were using, the contraception, the condoms. But somehow, I missed my periods because usually I'm very regular on my periods. So, I missed my periods and then I got myself checked. The pregnancy test was positive, but for the last 3 days, I got this, the discharge. So I got, the very upset. So I went to GP. So he did pregnancy test again, and so he said that it's better to go to hospital.
Okay, I understand, Andrea. And how about, is there any sickness?
I think it got stopped. For the last 5 to 6 days, I don't feel any more sick, and I don't feel like throwing up at all. Earlier, I was having vomitings, and even my breasts were very sore. But now, everything is okay.
Okay. Okay, Andrea. And how about the brownish discharge? Is it bright red or dark colored? And
No, it is somewhat dark in color, doctor.
okay. Is there any pain in the tummy?
No.
Okay. Do you pass any clots or any tissues in the or tissues in the through which to the down below?
No, no, not as such, doctor. It's just discharge on and off, and I don't even, need to use the pad as well.
Okay. Anytime did you have any giddiness?
No.
Okay. Any shoulder tip pain you had?
No, doctor.
Okay, Andrea. How about your waterworks? Any problem with your waterworks?
No, no, no. Everything is fine.
Okay. Any problem with your bowel movements?
No.
Okay. Andrea, is this your first pregnancy? Anytime you were pregnant before?
Well, doctor, to be very honest, with this partner, this is my first pregnancy. But I already had 2 miscarriages before as well. So that's why I was very upset that when I didn't feel any kind of nausea, vomiting, and the breast tenderness. So that's why I was very apprehensive. So, but let me tell you another thing, doctor. My current partner, he doesn't know about my previous miscarriages. So
Yeah,
please don't
I
tell
understand.
him. Yeah.
Yeah, yeah, sure, Andrea. Yeah, I will maintain the confidentiality. Unless
Yeah.
you tell us, it will not be broken. Your confidentiality will not be broken. Don't worry.
Yeah,
Can you tell your
appreciate.
previous miscarriages?
Well, doctor, the first miscarriage was when I was like 19 years of age, and that's what kind of missed miscarriage. And the when I missed my period, so I went to doctor. So he said that my pregnancy got stopped. The growing at the age of 6 weeks. So I
Okay.
had been given medications to clear that off. And then the second one was like the miscarriage on itself, and it was also like 8 to 10 weeks somewhere. So and it was also the finished by medications. So doctor, even though this pregnancy is unplanned, but I was really hoping that I could continue this pregnancy.
Yeah, I understand, Andrea. I understand your emotions. It is
Doctor.
truly understandable. Don't worry, we are all there here to help in all possible ways. Andrea,
Thank
can you
you.
tell me anytime in the past miscarriages or ultrasound was done and heartbeat was found? Anytime?
Yes, in first ultrasound, it was like miscarriage. No heartbeat was there, so they said that it stopped growing at 6 weeks. And although I was 8 months, 8 weeks on my the missed periods. So the second one, it was the kind of complete miscarriage. And later I had the scan, and it was kind of normal, no problem.
Okay, Andrea.
Yeah.
Andrea, and can you tell me about your blood group? What is your blood group?
Yes, doctor, it's O positive.
Okay. Any reservations for blood transfusions?
No,
Okay. Do you have any medical problems for which you visit your GP regularly?
no, doctor, not at all.
Okay. And have you undergone any surgery in the tummy or down below?
No, doctor, I'm generally fit and well.
Okay. Is there any allergy for medications?
Not as such.
Okay. Few personal questions, Andrea. Do you
Yes,
smoke,
doctor.
drink alcohol, or pardon to ask any recreational drugs usage?
Well, doctor, yes, I do smoke. I do smoke for about 7 to 8 cigarettes a day and alcohol just socially. But I stopped the smoking altogether when I found out I'm pregnant.
Yeah,
Yeah.
that's good, Andrea. I appreciate your effort
Yes,
that you have
doctor.
quit smoking. Yeah, and Andrea, how is your support at home?
Yeah, my partner is quite supportive and loving. In fact, he doesn't know about this pregnancy at all, and he doesn't even know that I'm here. But I'm hopeful that he will come around if I tell him that I'm pregnant and I'm seeing a doctor. So maybe,
Oh,
yeah. Yeah.
okay. And anytime in the past 4 weeks, have you been low in your mood or lacking interest in activities?
No, not as such. In fact, I'm so overwhelmed.
Okay. And what about your height to weight ratio?
It's like 24, I believe.
Okay. Thank you, Andrea, for sharing all this information with me. I would like to examine you in front of the chaperone. I'll record your heart, blood pressure, uh, saturation, and I'll examine your tummy for any pain on touch. Then I'll also examine locally. I'll put a small instrument called speculum, and I'll see whether how is the bleeding, and
Mm-hmm.
also look for the neck of the womb. How does it sound?
Okay. That's fine. That's fine. As long as it's okay.
Okay, Andrea. So, and uh, Andrea, I've examined you, and coming to the management, since you are having a brownish discharge and the pregnancy test is positive, so Andrea will be doing an ultrasound today to check
Mm-hmm.
whether the baby is formed, and a baby is formed, and what is heart rate, and we'll be doing certain blood tests, and look for a full blood count, and also pregnancy hormone test. Okay. Andrea, I've checked your ultrasound report. I've checked your name and NHS number on the ultrasound report. The report is showing that the have you anybody discussed the report with you, Andrea?
No, no, doctor.
Okay. Andrea, I see that today you're alone today. Do you want me to call anyone to support you?
Why, doctor? Is something wrong?
I'm sorry, Andrea. I'm having some difficult news to discuss with you. The
What type?
ultrasound
What kind of difficulties?
Yeah, the ultrasound report is showing that the baby's sac is formed, but there is no baby formed inside the sac. Uh,
What does
so
it mean to me?
yeah, this shows that it could be an early miscarriage, because the sac size is around 25 millimeter, and but there is no baby formed inside the sac. So it could be it could be a miscarriage.
Missed miscarriage again. Are you sure, doctor, that this is my report?
Yeah, I'm sorry, Andrea, to be the bearer of this news. I've checked your name and NHS number on this, and the report belongs to you, Andrea.
Oh my God. Oh my God, doctor. I
Yeah,
was not
all this.
hoping to have this news again. I already had 2 miscarriages.
Yeah, Andrea, you take this glass of
Oh my
water, no?
God.
Take this tissue paper. Calm
Yes,
down,
doctor.
Andrea. Yeah,
So, doctor, why this is happening again and again? What is the reason?
yeah, we have to find out, Andrea. Do you want me to discuss about the management now? What is the management options available?
My
We have
God.
to find out the cause. Yeah, I understand, Andrea.
Yes, doctor. Okay, but I'm literally clueless that why it is happening to me again and again. Is there something, I mean, is there anything, the fault in me, or I don't know what exactly it is.
Yeah, I understand, Andrea. I understand your emotions. Don't worry, we are here to help you. I'll be connecting you to the counselor so that you can cope up the situation in a better way. And once this pregnancy is managed, then we'll be doing certain tests to find out the cause. Most of the time, cause will not be found, but in some cases, certain tests can reveal some cause which is treatable. So in next
Okay, so
pregnancy, cause is
what is
found.
going to be now? Like, I mean, I'm having this brownish discharge, so what for this pregnancy?
Yeah,
What will happen now?
regarding the management, Andrea, there are three options. One is like expectant management. The second is the medical management, and
Mhm.
third is the surgical management. In expectant management, we can wait for the nature to take its course. We can wait for 3 weeks, 2 to 3 weeks, and nature will start. You'll start having pain and bleeding, and the nature will it will expel on its own.
Okay,
Okay, so the
so
second option is like yeah. You want to ask anything, Andrea?
no, no, doctor, no.
Yeah, the second option is we can give some medicines and we can make the womb to contract and we can make give some medicines and make the womb to contract and the neck of the womb also will soften and open and will expel the products, expel the pregnancy.
Hmm.
And
Okay,
this will, you will have more pain and bleeding more than the periods. Okay.
okay, okay, fine.
Yeah, the third option would be surgery, where you'll be admitted in to the hospital and you'll be put to sleep and you'll be seen by the sleep doctor and they put you to sleep and a small cannula will be passed into a small plastic cannula will be passed into your womb and the
Hmm.
pregnancy tissue will be sucked out. And if
Okay,
needed, since it's your third loss, we can send this tissue to the lab for testing to look for any problem with the genetic material of the baby. Am I clear, Andrew?
yes, yes, doctor, yes. Okay, fine. So, I mean, how would we be able to know that why this, the happening to me again and again? So, this is kind of, the third miscarriage, isn't it?
Yeah. So there are certain tests, Andrea, which has to be done once in between pregnancies. Once this pregnancy is dealt with, we can send some blood test and see if any proteins are raised in the body. And we can also send this pregnancy tissue for lab testing, where
Mhm.
the any problem with the uh, genetic material of the baby is there. If anything, any problem is detected, then your blood and your partner's blood also can be sent for lab testing.
Ah, okay, I
We'll
see,
also be
doctor.
doing some ultrasound, ultra imaging like ultrasound to look for any problem with the womb.
Mm-hmm. Okay, okay, fine, doctor.
Okay, Andrea, I'll be giving some patient information leaflet and I'll write back to the GP and I'll fix an appointment with the consultant. How does it sound?
Yes, yes, doctor. Thank you.
Okay, thank you, Andrea.
So, Shanti Priya, how was it?
I don't know. So much fumbling was there twice. That's what I call.
Okay, okay. So you knew from the station that this is going to be the miscarriage, right? So what do you, because you took exactly 13 minutes and a half, okay, to finish this
Yeah, my
station.
history I took long time.
Exactly. So do you think that you could have cut,
That's
the
what I felt
something?
in the. I saw some 6 7 minutes. 6 minutes I took. I think 6 to 7
Yes,
minutes.
7 minutes. And the exactly, what you have to do is that, of course, so many things were evident from the station, that this is going to be a Breaking Bad news station. This is going to be a negotiation station. And when she told you that, I already had two first trimester miscarriages, and this is again, the miscarriage, okay, 25 to 29. So this also makes for
Yes.
about, the 8 weeks, 7 weeks miscarriage. Yeah. And irregular sac, we can see, sac is very much irregular. So this is, the somewhat, the miscarriage again. So of course you can't, tell her that, there is any kind of hope. Okay. So in this scenario, you can simply, tell her that, okay, I understand that, this has come to you as a shock. Okay. And, but this will come under the heading of recurrent miscarriage. For the recurrent miscarriage, the first thing first you have to do, okay, let's first scan how did you do, and then we will come to the management. um the she is telling you that I have, the brownish vaginal discharge. Okay. And then again you are asking that, are you passing any tissues from down below, or are you passing anything? you know if she is telling you that I'm having the just discharge, the spotting, just take it as such. Even, the GP letter is also telling the same. Bowel movement, rather you can say simply that, how about your water work and bowel work, is there any problem? See, simple. Stay as simple as possible. Okay. And then allergy, okay, allergy is good, BMI is good. Why you need to do examination? Tummy examination, blood pressure examination, and I will put a speculum and I will do the local examination. Why?
Actually, this is always a confusion, ma'am, whether we should do examination
Okay.
or
Let me ask you, if a patient comes to you in your OPD with such a scan, do you do, the examination? Always,
ma'am,
do
the
you always
patient
do the
is
examination?
already examined before we give the scan. So like that we should take. So if they come with the reports, we need not examine them.
Exactly. So why in real exam, you have to say, I will put a speculum and I will take this, the swab, I will do the, it's not needed. Okay. If it is written that, she is pouring blood, the heavily, then of course you have to do the examination. Then there was, the one station, I believe that back in 2019 or 18, there was a station that, the patient has come with, the severe bleeding. And of course she was in, the somewhat, the shock, what we call it as, when, the clot gets clogged at, the cervix. Okay. So it was, somewhat, that kind of. So if you will do the per vaginal examination, per speculum examination, you will remove that clot, so of course she will get better. Okay. Vasovagal shock, we call it as, isn't it? So, somewhat, you have to take, the scenario as a whole. So I think you took at least 2 minutes for just this, the examination. If you can cut this, I think you can finish your station on time. Okay. In terms of, the management, now we have two things to address. First, for this pregnancy, and second, for recurrent miscarriage. So what do you do in terms of recurrent miscarriage for this pregnancy? Don't always, the say, and you can simply, the tell her that we do have, the three types of, the management, how we are going to deal with you. The first is going to be the conservative management, in which we are going to let the nature takes its course, and the process is going to be completed in for about 3 to 4 weeks time. And the second is with the, we can, the end this pregnancy with the help of, the medications. And the third option is going to be with the help of the surgical operation, what we call it as, either it could be the manual vacuum aspiration, or it can be the, the evacuation under anesthesia. Okay. So don't unnecessarily go that, we will give you injection, you will be put to sleep, and you will be up, and you will be this, and you will be this. You can simply say like this, and then you can, the say that, okay, because in this current, the scenario, you don't have to give, the so much of information, because this station is of for, the what, the breaking bad news first, and then you are going to tell her about, how she is going to be managed simply. Okay. So you can simply tell her that, okay, these three can be the options. And I understand, Andrea, that this is your third miscarriage, and you did very beautiful. You said that, we are not going to tell to your current partner that this has happened. So of course this is confidentiality, but for her you can tell that, I understand that, this is the third miscarriage for you, and and we need to find out the cause. And usually, even though, it is third recurrent miscarriage, but the partner is changed, we can do one thing is that, we can send the products of conception or products of pregnancy remains for the, the cytogenetic analysis. We call it as, the chromosomal study, because some of the time, in more than half of the cases, the first 3 months abortion is because of, the chromosomal abnormality, when there is mismatch in the chromosomes which are being inherited from both partners. Okay. So it is going to be that. And apart from that, you will be referred to recurrent, the miscarriage, the pregnancy clinic. Okay. High risk clinic, you are going to send her, and then you can say they might offer you some of the special tests as well, that why this is happening again and again. Okay. So, you can simply tell her. Okay. And the this Repeat scan, irregular sac 25 to 28. If patient asks you that, and she is already having bleeding, okay, and this is such a irregular sac 25 into 29 with no obvious fetal pole. We do expect at 25 millimeter that there is going to be yolk sac or fetal pole. If fetal pole is there, ideally there should be heartbeat. Okay, so you can offer her, if she asks you again and again that, what about, are you sure that this is, the this is scan, you can simply say that, okay, we can do one more thing, is that we can repeat this scan after 1 week time. Okay, and meanwhile, you have to be very much, the careful about your bleeding. Anytime if you feel that you are bleeding heavily and this discharge turns out to be into the, the heavy bleeding, okay, and if you think that, you are dizzy or you are having any kind of, the problem in breathing or something, you will immediately come. So you will give, even in this, the scenario, if she is going home with the leaflet, you are going to tell her the warning signs as well. Okay, so if somebody asks you that, the I have to go for second scan, so you can say, the simply that, yes, we can offer you second scan, but I'm afraid it is not going to change the outcome, because as a doctor, that 25 into 29, the it has to be fetal pole, there has to be fetal pole, there has to be fetal heartbeat. Okay, but you can go for second scan if the sac is regular, if the sac is regular, and if the sac is less than 25 millimeter, according to NICE guideline. Okay, it is more than 25 into 29, it is more than 25, so I'm afraid, it is not going to change the outcome, even if you have to give the, the second scan option. Okay, according to the NICE guideline, if the sac size is less than 25 then you have to offer second scan, because then there is possibility that fetal pole might come. Okay, anything can happen. All right, Yasmin, Mirdu, is it clear? Okay, so Shanti, you have said, the one thing, baby has been formed, and the this an irregular sac is there, and I can see there is no baby and there is no sac. So how do you, the call it? How do you, the explain the scan? Hmm?
Sac is formed, but no baby is formed. Right?
Baby?
Fetal,
If you will say baby, so she will understand it is baby. So from where you will bring baby at 6 weeks?
pregnancy. Then how?
How do you counsel? How do you say? How do you tell it? Yeah, that is important, and that needs to be, the mustered up. This is very much important. Okay, you can simply say that, I understand that, okay, Andrea, I have your scan and I have checked your name and age and NHS number, and this scan belongs to you, and this scan shows that, the pregnancy sac is there, but there is no signs of, the life, or you can say that, there is no early, the formation of the, the baby is there. Okay, we call it as
Early
fetus.
stage.
Ideally, what happens is that, once fertilization happens, the once the pregnancy is going to be, the formed, so first of all there is going to be a pregnancy sac, and then in pregnancy sac there is going to be a baby which is going to form later on. Okay, and then with the passage of time, it grows, and, it takes a complete shape of baby. But in this, I can see that, ideally at 25 millimeter of, the gestation sac, there has to be some signs of the, the fetus over there, but this is empty. Okay, and the sac, the size is also irregular. That shows that, that this pregnancy has stopped growing at early stage, and I'm afraid, and I'm so sorry to tell you that, this is miscarriage again. Miscarriage, okay, then, the same things will go. But remember, if we will start, the saying all the time that baby, 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 I'm afraid, the baby will not come at, the 6 weeks, 7 weeks, 8 weeks scan. Okay, you can say fetus, you can say that, the growing baby, growing fetus, this is how, you can simply tell.
Okay. Yes.
Okay. And then you have told in terms of, like I've told you, okay, cut your examination, cut your some of the, the history points. Family history is not important here. Okay, allergy status, okay, surgery, okay, BMI good, and the things which are important for you to manage this case. So in this particular scenario, this is recurrent miscarriage, so first of all you have to manage this case. this particular scenario, and then you have to send her for recurrent, the miscarriage, the evaluation. Okay. So you will send
yes,
her for the recurrent miscarriage pregnancy clinic. Then you are going to just give her idea that, okay, this is how it is going to be. That, first of all, we might need to send the pregnancy remains to the laboratory for histopathological analysis. Secondly, we might need to do some of the blood tests to find out that if you have any kind of, the blood clotting, the problem. So, that's why, the pregnancy is getting stopped. But, that can be discussed in a while. And at the moment, we have to manage this, the pregnancy. Okay. So we do have these, the three options. So whichever options you will choose, we will support you in that. But, before you go home, let me tell you that you have to be very watchful about, the bleeding. You have to be very watchful about pain. And if any time you feel that you are feeling so dizzy, or you will immediately come to hospital. Okay. And, you can
Yes.
ask few more questions as well. How far do you live from hospital? Do you have your own transport? Do you think that, you can come to the hospital in emergency? You will give her, the emergency contact details. You will give her, the support group, the miscarriage association. You are going to put her in touch with, the support group like miscarriage association. And then, of course, you are going to give her patient information leaflet. So this is how you are going to close your loop. So always remember, in 10 minutes station, you have to show sympathy. You have to show applied clinical knowledge. You have to bring your patient safety as well, and you have to manage the case as well. Okay.
Yes, ma'am.
Okay. Okay. Good. Are you going for November exam?
Yes, ma'am. Yes, ma'am.
Practice. Okay. Practice well.
Yes.
Do try to practice 3 to 4 cases a day. Okay. Read them thoroughly. Practice it with your study buddy. Okay. So I hope,
Yes, ma'am.
inshallah, it will be good. Okay.
Thank you. Thank
Good
you.
job. Okay. 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 Clear, everyone? Any question?
Dr. Zaib, can I ask one question?
Mm-hmm.
Yeah. As you said, family history not important, but in case she has a thrombophilia,
You can ask. You can ask.
like
Because in this scenario, the partner, the partner, there is no involvement of partner. Okay. So most of the time, the genetic involvement can be because of the, the partner. First trimester miscarriages, APS is only 10%. More than 50% is chromosomal, the defects. Okay. So you can ask, if you really wish to. There is no hard and fast rule, but always, try to mold according to this patient.
okay. Thank you.
Okay. Okay. Any other question?
Ma'am, and one more doubt, ma'am. Since she had brownish discharge, ma'am, ectopic pregnancy also we have to rule out, ma'am, history.
Yes,
only
you
ask
have
that-
ruled out. You asked shoulder tip pain. You asked if there is any lower tummy pain. So you have ruled out. Okay.
I'm asking we
You've
should
ruled
do
out.
no, ma'am, that we have to ask those.
Yes, 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 yes.
Okay.
Early pregnancy, what are the, the sign and symptoms? Basically, patient presents with what? Abdominal pain, bleeding, okay, nausea, vomiting, okay. So other questions you can add in terms of, the ectopic pregnancy or molar pregnancy as well. If you think that you have to inquire about, the molar tissues, if you have to inquire about, the ruptured ectopic, or if you have to inquire about, the anything. So 3-4 questions are going to be there: pain, bleeding, and, the general well-being.
Okay. Yes.
Okay.
Thank you.
Okay. Okay. Welcome. Okay. Any other question, guys?
Yeah, just a minute. Because of already ultrasound we have got, still we need to ask about ectopic symptom related ectopic. Because
This
we know by
ultrasound has been
ultrasound.
given. This ultrasound will be given if you will, tell in your management. If you will not say that
Okay.
I'm going to do the ultrasound, nobody is going to show you ultrasound.
Okay.
Yes.
Thank you. Thank
Yes.
you.
Always remember this. Okay.
Okay.
If you will never say that, I will go for ultrasound, no one will show you this ultrasound report. Then I think Shanti Priya was about to to tell that, okay, I have examined you, but there were no examination finding. You don't have to lie. Okay. You don't have to speculate anything on your own until and unless something is evident on your screen, until and unless something is shown to you. Okay.
Thank you.
Excuse me, Dr.
Okay.
Zaib.
Yes.
Can I share something?
Yes, please.
As you told that unplanned pregnancy, so we have to tell about the reliable contraception advice.
But she said, I'm happy to continue.
No, now already you miscarriage, isn't it? You are unplanned pregnancy. So we have to, at the end, we have to give her that for reliable contraception advice.
If time is there, you can tell her, okay? If you think
Yeah.
that you have got time, so you can bring as many things as possible, provided first you have finished your task, and then you can bring, whatever you want to. Okay, there is no hard and fast rule, trust me.
Yeah.
Okay.
Another things that for NICE, according to the NICE guideline, if it is even the equal or more than 25 millimeter gestational sac, so we have to give her either another scan, or if she cannot believe this, that no, how it is possible, then at the time I can give her another opinion also.
You can give, okay.
Yeah.
Ultrasound is what? Ultrasound, if it has been confirmed by 2 experienced sonographer at the same time, okay, in the same sitting for the same scan, then it is confirmed, okay. Or if the findings are like, I mean, the sac size is more than 25 the millimeter, so of course it is going to be almost confirmed. Clinically, this is what we see, okay, and clinically, that this is what we do.
And you are very upset also, and then showing that and 3 miscarriage also. So counselor and support group you
Whatever,
told, but counselor, yeah.
if time allows that, yes, you can put her in touch with. But at this moment, in this particular station, she hasn't told her partner, okay, her partner doesn't know anything, so maybe when she will meet her partner, so she will be okay. But on your behalf, you can say that I can understand that, sometimes what happens is that I mean, it is very hard to cope with such, the news. So we do have a very good support system, and I can connect you with in touch with the counselor. So would that be okay for you?
And you are very anxious also, and you are crying, and 3 miscarriage. So do you think we can ask the holy question?
She asked, yes. She
Yeah.
asked, Shantipriya asked as well.
Yeah, she asks also. Yeah.
She asked, yes.
Yeah.
So that is part of, the almost history. Okay.
Yeah. Thank you very much.
Okay. Great. BBN full means? BBN full means?
Breaking bad news.
Full means?
It's we have to ask her that do you want someone to be with you before I discuss the report?
Exactly.
Then means 2 warning shot and all that we have to do in this also.
Yes, exactly. Okay. So BBN should be in steps. BBN should be in chunks. Information should be given in chunks. Okay. Whatever you are, the talking in that particular scenario. So you have to give, the information in chunks.
Dr. Zaib, I had one confusion because you said my partner doesn't know I'm pregnant. So is that some she may have this pregnancy with another partner? So confidential.
No. She said, Shantipriya said, that nobody will come to, come to know about this until unless you will, ask us. Okay.
Maybe I joined the late. Okay.
No problem. Yes, confidentiality will be there. Of course. Confidentiality will be there.
Thank you.
Okay. Welcome. Any other question? Any other question, guys? Hira, Mehnaz, Fatima, Amal, Shazia, Iman, everyone, Manikam.
Yes, Dr. Zaib, here 3 abortion or 3 miscarriage, but mostly 2 of them without formation of fetus, only empty sac. And the third one is, I think it was 1 fetus formed. Here is no point for antiphospholipid, yeah?
No. We are not talking about antiphospholipid at the moment, okay? If you just go the
Okay.
hierarchy of the recurrent miscarriage, so more than 50% is chromosomal analysis, APS is only 10%. Okay, for the APS, you have to have a complete criteria. Okay, you have to, then you will follow that criteria. If you really think that none of the other investigations are coming to the terms of the recurrent miscarriage, then of course you will follow the APS criteria.
Okay.
Okay, yes.
Okay.
And APS is just 15%, as long as I remember from guideline.
Yes. Okay.
Yes. Okay.
Okay. Thank you.
Okay. All right. Right. Any other question, guys?
Dr. Zaib, excuse me. If
Mhm.
there is a, for miscarriage, if there is a septate uterus or bicarbonate uterus, if recurrent miscarriage, so at
Mhm.
that time, do you think that we can, like if it is a structured discussion or, yeah, so we can, to exclude this recurrent miscarriage, the cause, so
Mhm.
we further investigation, if we can say that to confirm this septate uterus, that 3D ultrasonography, and also to exclude other cause that
According to the
laparoscopy,
guideline, even 2D is enough.
yeah,
Okay, the normal one.
2D and MRI also, and hysteroscopy, laparoscopy for further
Mhm.
investigation.
Mhm. Mhm. Mhm.
That means still we cannot diagnose. Then
Of course,
we'll go back.
when it comes to
Yeah,
structure discussion, you can bring whatever you want to.
all of these
Because that
things.
is a
Yeah.
structure. Exactly. Exactly. In structure discussion, yes, there are going to be the plenty of things. Okay.
Yeah. Yeah.
And I think there was one of the question in which they asked about that. Okay, this patient has septate uterus. Do you think that septoplasty is going to help? What exactly you are going to do for this, the woman? So yes, the hysteroscopic resection is there of the septum, but there is no evidence
Yeah.
that there is going
Repeatedly.
to be exactly, there is not there is no evidence that then later on there is going to be clinical, the pregnancy rate and the pregnancies are going to be good, because whenever there is going to be defect in the endometrium, that will
Mm.
cause problem later on. Okay, there is going to be defective implantation, the chances of miscarriages can be high later on. Whatever is going to be with the endometrium, the things are going to be very tricky in the next pregnancy. Be it uterine artery embolization, be it the endometrial ablation, or the septoplasty, septum resection, or anything. When you are doing anything in the uterine cavity, so it means you are disturbing the environment, normal environment. So the
Mhm.
miscarriages rate are going to be high in that. So yes.
So, Uterine embolism, somewhere it is written it will not interfere the
No,
fertility,
it is.
and
It is.
HMB guideline is written that it will not interfere.
No.
The
It
nice
is.
guideline.
Miscarriage rate is here. The APH rate is here. Okay. Placenta
Yeah.
previa accreta is there. So no. Miscarriage is there. Miscarriage is there. There is an
No,
opinion paper on UAE, so it is written on there.
yeah, there is a amenorrhea also, premature amenorrhea. There is a,
Yes,
so
yes,
it
of
can
course.
cause, isn't it? Yeah.
Yes,
Okay.
yes.
Thank you. Thank you.
Okay, that's great. So next week is what? Next week is today is what? October 7th. Okay. So next day is 14, and after that 21st. So I will be taking the another session next week, and then we will have one of the revision session. So if anybody has any query, anything, so you guys can bring that query. So that is going to be our the queries, because afterwards I'll be very busy because I have to travel, I have to conduct on-site course for the med exam expert. Okay. And guys, we are having the course this time, okay, on site. So of course I'll be there, and we are conducting that. So anybody who really wish to have the real exam, like the scenarios and experience, so are encouraged to to join me. Okay. So hopefully, inshallah, I will see you next week, because after that I'll be so busy, and perhaps it's not going to be possible for me to conduct any more sessions, but I will see. Okay, I will see, because I have to do the 1 or 2 sessions on queries and all. Okay. Thank you
Thank
so
you
much.
very much.
Thank you so much.
Thank you. Thank
Thank
Thank you
you.
so much. Thank you so much for wonderful participation. Okay. So inshallah, I will see you guys next week. Till then, keep practicing. Practice is the key for this exam, guys. Okay. Doesn't matter if you have the so many courses with you. Doesn't matter if you have a lot of information, a lot of ready-made templates with you. It's not going to help until unless you will speak. Okay. until and unless you will perform, until and unless you are going to be corrected by anyone. Okay, so keep practicing, stay focused. Inshallah, I will see you guys next week. Okay, bye bye.
Thank you.